Smiliness, sponsored by Health for Nigeria. My name is Folashade Ajiboye, popularly known as the Smiliness. And in this episode, we're talking about the concluding part of depression. During the last episode, we were able to talk about what depression is all about. So in this episode, we'll be talking about the prevention and the treatment of depression. Let's start with the treatment of depression. When you went through the first episode about depression, you're wondering, is depression treatable? Yes, depression is very treatable, and the most effective approach towards the treatment of depression is 1. Medication, and 2. Talk therapy. Medication includes the use of drugs, injections to treat depression. And drug has quick impacts on the signs and symptoms of depression. Like if you take drug now, within few hours, the person will be fine, will be free from the symptoms. But talk therapy includes counseling and encouragement. A depressed person needs a good support system. Through your counseling, advice, discussing together, going out together, talking to the person, encouraging the person will be fine. So combining counseling, encouragement, and drugs is the best treatment for depression. It is a pity that people are not ready to support those that are experiencing depression. They stigmatize them, which is not good. And that is why most people experiencing depression, they don't come out. They don't speak up because they know people will run away from them. This is the best time to help them. This is the best time to talk to them. This is the best time to show that you are a true friend. It is the best time to show that you are a good partner. It is the best time to show that you are a good daughter. To your parents, if they are experiencing depression, see, anybody can be a victim of depression. So with that, going through the first episode again, look at the signs and symptoms. Check those around you. Is there anybody manifesting those signs and symptoms? You need to help the person. It's not the time to stigmatize them. It is the time to help them. Go out there and help someone experiencing depression.
You are strong, you are wise, you are worth beyond 1,000 reasons why. And you can be perfect, baby, 'cause nobody's perfect, darling. But no, there's nobody in the world like you.
Let's move to the prevention of depression. The country is bad, yes. Things are getting tough and tough day by day. What can I do to prevent depression? What can I do so that I won't enter into depression? Okay, now, the first thing you need to do is stay away from toxic people.
Run.
Toxic people, they are everywhere. They want to take advantage of you. They want you to feel whatever you are doing is bad. If you buy a new car, they want you to feel that car is a low level car. You are not to their standard. You have to stay away from them at all costs. Number 2, you need to build strong relationships. Connect with people.
For a long time, I've been looking for my Jackie. Dropping your contact, girl, you deserve that loving. No, turn me to high man. Are you okay?
Connect with families and friends. Don't be a lone ranger. You can't live this life alone. Yes, I said you should stay away from toxic people, but there are still good people out there. You can't be on your own, because being on your own can make you to think and think and think, and you will think what you should not think. Yes, I know your life might be busy, you might not have time, but the little time you have, use it to attend social events. Use it to connect with people, call people, gist with people, talk to your friends, call them on phone, hang out together, find new hobbies, and you will see that depression will be very far away from you. Number 4, You need to reduce stress. Yes. Life is stressful, especially for youth. Yes, you want to make it, you want to make money, you are combining 3 jobs, you are combining 5 jobs together because you want to build a new house, you want to buy a new car. Please, I'm begging you, reduce stress. Chronic stress is one of the major causes of depression. You can't do everything. You can't do it. And if you are a parent, let's say you are a mother, you be the one to wash plates, wash clothes, you sweep. Even if your children want to help you, they can't do it well. Mommy, please reduce stress. You need to reduce stress. And as young people, you need to know how to manage and cope with stress. Number 5, you need to get enough sleep. Yes. Health professionals will tell you sleep for 8 hours. Motivational speakers will tell you if you are sleeping for 3 hours, poverty will hit you.
Will you keep quiet?
Hey, you've worked yourself out during the day. You need to rest at night. You need rest. You can't keep working for 20 hours in 24 hours. No. Because if your body should request for that rest, if your body should request for it, you will sleep more than 20 hours. You will sleep more than 8 hours. So you need to find time to rest, sleep. Number 6, you need to eat well. Eat well so that you'll be fine. I don't joke with food though. I don't play with food. The smiling nose, I eat well.
Problem no dey finish, enjoy yourself. Wahala for the person we no one flex. Even though the government they make us vex. No do like zombie, enjoy yourself.
So you need to eat good food. Eat well. Because you are what you eat. If you are eating a depressed food, you will be depressed. If you are eating a good, healthy diet, you'll be good. You'll be healthy. Eat well because you are what you eat. Number 7, you need to read drug prescription labels very well before you take it. Or let me say, don't practice self-medication.
You get it? Okay. If you don't get it, forget about it.
Because, you might be on a particular drug, maybe prescribed by your doctor, and now you are having another symptom. You now went ahead to buy a new drug on your own without consulting your doctor or your nurse. You are doing yourself a great harm, because there are some drugs that the side effect is depression, that you be depressed. There are drugs that can lead to brain damage. There are drugs that can lead to, when combined together, drugs interactions. So you need to consult your doctor before you use any drug, and make sure you read the labels well before you take any drugs. Number 8, you need to maintain a healthy weight, or let me say, love yourself the way you are. Especially obese or fat people, they have problem with their weight, with the way they look, and maybe because people make jest of them, people use their weight to manipulate or take advantage of them. They used to feel depressed. So if you don't like the way you look, you don't like your weight, you need to work on it. But I advise you to love yourself the way you are. The last but not the least, number 9, you need to plan for unavoidable depression triggers. For example, the anniversary of a death, the anniversary of a breakup, divorce, or maybe after your breakup, your ex will be attending your friend's party, which you yourself will be attending with a partner, and you don't have a partner, you don't have a new fiancé or boyfriend yet. You might want to get the person them together at a party. So the thing you need to do is know that the event is coming up, then plan with someone to check in with you, then remind yourself that you will get through it. So we were able to discuss the treatment and the prevention of depression in our episode today. So having gone through that, I want you to ruminate on things you've heard, then you adjust where necessary. See you next time, guys. I remain Folashade Ajiboye, the Smiling Nurse, being sponsored by Air for Nigeria. Bye.